I mean, I think the biggest challenge all of us are facing is really just the ambiguity of what's happening on a federal level, and I think really the speed or the pace of the change from volume to value is really a big question that all groups and all organizations face today. We have really at Ochsner embraced value-based care, so we are actually pushing forward much more aggressively than we find others around in our area. We think it's the right way to do things. We believe in global capitation and taking full risk, and we just like that model and think it really lends the right way to take care of patients, the right amount of services in the right place and the right location. So we have really just chosen the course to be much more aggressive in value-based reimbursement and really try to put fee-for-service behind us over time. We created a new company called Innovation Ochsner. We got a small team, 20, 30 people that are constantly working on new innovations in digital health, in patient engagement, new telemedicine capabilities. So we have really, and then we've embraced things like telemedicine in a much bigger way. I think that's going to be a huge impact in our industry going forward. So we've really tried to embrace the changes, keep track of these new startup companies that we see. I mean, they're not all going to make it, but you need to kind of be in touch with what's happening there. Because at the end of the day, the new startups are focused on solving pain points for our patients. And if they solve pain points, they're going to be successful. So we need to constantly be working ourselves to solve our pain points, make sure we're doing the right things for our patients. I think one of the things is you've got to be a good communicator. With all of the complexity we see out there and all the noise, from a news perspective and all the information coming to us, you've got to be able to take information, simplify it, and be able to communicate to your key audiences what's going on, whether it's your board, whether it's your physician group, your employees. I think that's critically important. I think the other is, today, you got to have courage. You've got to be willing to step out. You've got to take some chances. And there's a lot that are challenged there, quite frankly, and scared to make mistakes. And we all make mistakes, but you've got to take a step forward. You've got to be willing to take a chance on some of these things. And I think it's critically important if you're going to be a good leader to be able to do that.